Hello students, today I will discuss about the osteology of maxilla. Now this maxilla will discuss into the two part. In today's session I will discuss mainly about the features of the body of the maxilla, and in the next session we will see the remaining part of the maxilla. Now you know that it is a paired bone, and when we will talk about the maxilla, it is going to form your upper jaw where you will have the maxillary teeth. Now, when you will see the book, you will find some important terminology regarding the maxilla, that it is a pyramidal bone. Now, this pyramidal bone means that whenever we are talking about the pyramid is always having a base and the apex. So, suppose this is the pyramid, and this pyramid is a structure where you will have the apical area and this is the base. Now, if you will fit this pyramid into the maxillae, how it is going to place that this is the apex. Now this side you will have the apex, and it is going to make a pyramid like this. Now when you will put this here, you are able to understand that this will become the medial side or the base of the maxilla, and this apex is facing laterally towards this zygomatic bone. Clear? Now, this is the one thing which you always keep in mind, that base is on the medial side, that is towards the nose. Now, this body is having the four surfaces. Now, these are the facial surface. Facial surface means the surface which is visible anteriorly. Then you will have the orbital surface. Now, orbital surface is the surface which is the superior surface entering into the orbit, where it is going to form the floor of the orbit. Infratemporal surface is the posterior surface, and it is an important surface which lies behind the maxilla. And you will have the nasal surface, which is the medial surface of the maxilla. So these are the four surfaces of the maxilla. Now when we will talk about the processes of the maxilla, maxilla is having the four very important process. Now one process which is projecting upward is known as frontal process. One process which is going laterally and making a joint with the zygomatic bone is zygomatic process. One process which is projecting downward, where you will have the teeth, is known as alveolar process. And one process which is not visible into this front view because it is a horizontal projection which is going to form your hard palate is known as palatine process. So the bone is having the four body surfaces and it is having the four processes. So in this session we will mainly discuss about the four areas in detail, and in the part 2 we will discuss about the processes. So here, if you will see this video clip, you are able to understand that this is the maxilla, and if you will isolate the maxilla, you are able to see that this is the frontal process, this is your zygomatic process, this is your alveolar process. Now when you will turn the axilla on the medial side, you will find a projection of which is going to form the hard palate is palatine process. Now when you will see the surfaces, this is your facial surface or the frontal area, this is your posterior surface or infratemporal surface, this is your orbital surface on the superior aspect, and this is the nasal surface on the medial side, where you will have a big opening of maxillary sinus, which is known as maxillary hiatus. So these are the important things which are helpful in the side determination of the bone, because when you are keeping the bone in your hand, you have to keep these points in your mind, that whenever we are determining the side of the maxilla, you have to put this part in the downward area, frontal process in upward area. You will find a nasal notch or a margin which is medially along with the medial or the nasal surface. Now we will move to the first anterior surface. Now when you will see the anterior surface is medially limited by the nasal notch. So here you can see that this is known as nasal notch, and this notch is going to become, or you can say it complete when there is a articulation with the opposite side of maxilla. Now there is a very important landmark is seen on the face, and that is known as canine eminence. Now when you will see the teeth, we will start with the incisors, then you will have canine, then you will have premolar and molar. So there are two incisors are there and there is a single canine. Now when you will count this, now this is your midline. So these 1 and 2, these are your incisors. Now next to the incisors, this is the canine, and above the canine you will have the projection here which is produced by the root of this canine tooth, and that is known as canine eminence. So canine eminence is a vertical elevation and it is formed by the socket, and in the socket you will have the root. Now you will have the two fossa on both the side of this eminence. One is on the medial side, which is known as incisive fossa. So this area is become incisive fossa, and the area which is lateral to that is known as canine fossa. So canine fossa is lateral and incisive fossa is medial to the canine eminence. Now the next important bony landmark is infraorbital foramen and infraorbital margin. Now this infraorbital margin is the inferior border of your orbit, and this is contributed medially by the maxilla and laterally by the zygomatic bone. Now on this surface you will have a foramen, and this foramen is known as infraorbital foramen. Now dear student, there is a very important thing in the front of the face, that if you will draw a vertical line which is passing through the infraorbital foramen, you will see that the upper part of the line is passing through the supraorbital foramen, and in below this line passes through the mantle foramen. Clear? So this is the important landmark, is infraorbital foramen. So which are the muscles you will have on the face, particularly we are talking about the maxilla. So first is incisive fossa. Now incisive fossa, which is medial to the canine eminence, give rise to a muscle is known as depressor septi. So you will have the attachment or origin of the muscle here is depressor septi. Now below the incisive fossa, along this alveolar line, you will have the incisivus superior and orbicularis oris. So these muscles will present along this margin here, where you will find these two muscles. Then above the incisive fossa. Now above the incisive fossa, along the nasal notch, that means here you will find a muscle which is known as nasalis. In this area you will have a muscle known as nasalis. Then you will have the muscle which is known as levator anguli oris. Now this levator anguli oris arises in the area of canine fossa but below the infraorbital foramen. So this is the infraorbital foramen, and here is this your canine fossa. So in this area you will have this muscle is known as levator anguli oris. Now you will have one more muscle, levator labii superioris. Now this levator labii superioris arises above the infraorbital foramen but below the margin. So between the margin and the foramen you will have a muscle is known as levator labii superioris. So these muscles you can also appreciate in this diagram, where you will find this is your levator labii superioris. Now this levator labii superioris above the infraorbital foramen. Now below the infraorbital foramen you will have the muscle is levator anguli oris, which is here. Then you will have the muscle along the nasal aperture, which is your nasalis. Then you will have the depressor septi, which is here in the incisive fossa, and there are lots of list of long muscles which are present here, but these are the important muscles which you are able to see on the facial surface of maxilla. Now we will move to this diagram, which we have already discussed in my previous classes of the muscles of the face, where you can see this levator anguli oris, which is arises below the infraorbital foramen. This is an important one because sometimes you will have image based question. So you have to keep in mind that below the orbital foramen, this area is for levator anguli oris. Clear? Now we will move to the posterior surface, which is known as infratemporal surface. Now why it is known as infratemporal surface? Because it is making an anterior wall of infratemporal fossa. Clear? So now here if you will see that this is the infratemporal fossa, this is your zygomatic process. Above that you will have temporal fossa, below you will have infratemporal fossa. In this infratemporal fossa, the lateral boundary is formed by the mandible, and we have removed the mandible, so you are able to see this is the posterior area of maxilla, which is forming the anterior wall of infratemporal fossa, and this is the roof of the infratemporal fossa, which is formed by the inferior surface of greater wing of sphenoid bone. Clear? Now, in this posterior surface of the maxilla, what you are going to see is the 2 or 3 small openings. Now, here you can see the openings are visible. These openings are for the posterior superior alveolar nerve. Because these are the superior teeth, and that's why they are known as superior alveolar teeth, and there are 3 nerves which are supplying these upper line. One is anterior, one is middle, and another is posterior superior alveolar nerve. So here we are discussing the posterior superior alveolar nerves which are entering into the posterior teeth by piercing this surface, and for that you will have the small foramina. Then at the lower end you will find an important projection is known as maxillary tuberosity. So this point is known as maxillary tuberosity of the maxilla, and this tuberosity is going to give placement or origin to the superficial head of medial pterygoid muscle. So you know that medial pterygoid is having 2 heads, deep head and superficial head attached here on the maxillary tuberosity. Now there is one important question, that this maxillary tuberosity posteriorly going to make a joint with which bone? Now here you will see that this is the wing of sphenoid, but dear student, you have to understand, which is more clear in this image, that this wing of sphenoid is not going to make a joint with this part of the maxilla directly. Now in between you can see this green color structure, and here this green color area is known as pyramidal process of palatine bone. That means between the lower end of the pterygoid processes and the posterior part of the maxilla, you will have a small horizontal portion of the palatine bone, and its medial part is known as pyramidal process. So this maxillary tuberosity articulate with the pyramidal process, which you can see here in this video, that when we'll talk about the infratemporal, or you can say the posterior surface of the body, we are first removing the other bones to make it more clear. So we have removed the mandible. Now once you will remove the mandible, you have removed basically the lateral wall. Now you are able to see the infratemporal region, and here is the anterior wall of infratemporal region formed by the maxilla, where you are able to appreciate these small foramina. Now we have removed the zygomatic bone for the proper visualization. Now in this area you can see that this area is known as infratemporal surface. Now posteriorly you will have the this pterygoid processes of the sphenoid bone, but in between them you have to make it clear that there is a presence of a small projection of the palatine bone here, which is known as pyramidal process. Now you know that this space is known as pterygomaxillary fissure, and deep to the fissure you will have pterygopalatine fossa. Now here it should be clear that palatine bone is basically a partition between the nasal cavity medially and pterygopalatine fossa laterally. Clear? So this plate of perpendicular plate of palatine bone is a partition between the pterygopalatine fossa, and more lateral to pterygopalatine fossa you will have infratemporal fossa, and medial to the plate you will have the nasal cavity, and this pyramidal process is important, which is making a joint behind the your maxillary tuberosity. Clear? Now we will see the posterior superior alveolar nerve. Now posterior superior alveolar nerve is also important because they are going to supply the posterior teeth. Now here you can see that this is the posterior superior alveolar nerve, which are coming down from the pterygopalatine fossa from the maxillary nerve, and then these nerves are entering at this point inside the bone. Clear? So these nerves are the coming from this maxillary nerve. Maxillary nerve, you know that it is a branch of trigeminal, and it is passing through the foramen rotundum, which is a horizontal canal. Foramen rotundum is not vertical, and once it is passing through the foramen rotundum, it enters into the pterygopalatine fossa, and then you can see the posterior superior alveolar nerve is arising, and they are entering here at this point into the posterior part of maxillary body. Clear? So now we'll move to the next surface is the orbital surface. Now orbital surface is the superior surface which form the floor of the orbit. Now here you can see that this is the orbit and this is the floor of the orbit. Now into this floor you will find the infraorbital groove. Now where is the groove? Now this is the infraorbital groove which is present into the floor. Now this groove is continue with the canal. Now canal will come here which is not visible right now, and canal will end anteriorly on the infraorbital foramen. So you will have a groove will continue with the canal inside the bone, and canal anteriorly gives the opening on the face as a infraorbital foramen. Now this portion of your orbital surface is having the three borders. Now anterior border, now this is the anterior border which is known as inferior orbital margin. There is a posterior border. Now if you see this posterior border, now behind the posterior border you are able to see an opening. Now this opening is known as inferior orbital fissure. It is known as inferior orbital fissure. So this posterior border forming the anterior margin of inferior orbital fissure, which is a communication between the orbit and infratemporal fossa. So sometimes you have this question that what is the communication of the orbit. So one is inferior orbital fissure which is communicating the orbit to your infratemporal fossa. Then you will have the medial border. Now medial border is this border, and this medial border is having a lacrimal notch, and this notch will convert it into the nasolacrimal canal when it is articulate with the lacrimal bone. Clear? So how many boundaries? This is your anterior boundary, this is posterior boundary, and this is the medial boundary of orbital surface. Now for the lacrimal notch, if you will see the nasolacrimal apparatus, you know that you will have a sac. Now this is the sac which is present here right now on the medial side, and this sac lies into the lacrimal groove. Now here if you will remove the sac, you are able to see a complete area which is a concave area. Now this groove is contributed posteriorly by the lacrimal bone, and anteriorly it is contributed by this lacrimal notch of the medial border of maxilla. So you can see that this is the notch and this is the lacrimal bone, and in between you will have a suture line which is known as lacrimo-maxillary suture. This line is known as lacrimo-maxillary suture, and this suture is basically present into the floor of lacrimal notch, and this is having the nasolacrimal apparatus, or you can say the upper part of the nasolacrimal duct, which is a dilated sac. Clear? So that is present into this area on the medial border. This is the inferior border and this is the medial border. Now what are the muscles arises from the orbital surface? So you will have only one muscle is known as inferior oblique. Now you can see that this inferior oblique is arising from the surface. From which part of the surface? Anteromedial part of the orbital surface. So you can see that this is the surface which is on the medial side. The muscle is taking the lateral course, it is going laterally along the floor, and then it is going to make a turn to insert into the eyeball. So this is the point of origin which is into the anteromedial. So this is the nose, so but obviously it is a medial aspect, this is the lateral aspect, so it is taking origin from the floor near the anteromedial aspect. This is an important question for your exam. Then if you will see the relation of infraorbital nerve with the orbital surface, here you can see that this is your maxillary nerve, this is your ophthalmic division, and this is your mandibular division. Now this maxillary nerve entering into the foramen rotundum of sphenoid bone, and once it is passing through this, where it is going to open? It is going to open into the pterygopalatine fossa. So we have removed the bone. Now you can see that this is your maxillary nerve. Now this maxillary nerve is giving a nerve which is going like this. Now this nerve is your infraorbital nerve. Now this infraorbital nerve is entering into the infraorbital groove, and then the groove will convert into the canal. So here you can see that this is entering into the infraorbital groove, passing with the inferior orbital fissure. Once it will enter into the groove, it is entering into the canal, and at the end of the canal it is terminating on the face, coming out at the infraorbital foramen and dividing into the branches to supply the skin of the face. Here you can see that how it will come out. So till this point it is visible here, but after that it is not visible because it is inside the bony canal, and then again the terminal branches are visible, which is actually the infraorbital foramen area. Clear? Now here you can see very important relation is how this part of the nerve which is not visible, which is into the bony canal, gives two more alveolar nerve, anterior and middle superior alveolar nerve, to supply your remaining line of teeth. So how it is there? For that you just see this video clip, that once this infraorbital nerve will enter into the canal, here you can see that into the floor of canal you are able to see this middle superior alveolar nerve which is supplying the middle teeth line, and this is anterior superior alveolar nerve. Now this anterior superior alveolar nerve running into a bony canal, and this bony canal is known as canalis sinusus. So this is a question for your exam. What is canalis sinusus? So canalis sinusus is a canal which is present into the floor, and in this floor you can see that there is a nerve. Now this nerve is anterior superior alveolar nerve, and the course of the nerve is not visible outside because this canal is deep into the body of maxilla. So there are three superior alveolar nerve: anterior, middle and posterior superior alveolar nerve. Posterior superior is a direct branch, but anterior and middle are the branch of infraorbital which arises into this canal of orbital floor. Clear? Now we'll move to the nasal surface. This is the nasal surface, which is the medial surface, and this is going to form your lateral wall of the nose. So this is the lateral wall of the nose, and this is the medial side of maxilla. Now this surface is identified by a large opening of the maxillary sinus which is known as hiatus. Now there is an inferior nasal meatus lies below the hiatus. So this area is known as inferior nasal meatus. Meatus means the space. So this is the inferior nasal meatus lies below the hiatus, and the nasolacrimal groove lies in front of the hiatus. So this is the nasolacrimal groove. Now this nasolacrimal groove carries the nasolacrimal duct, and this duct will open into the inferior meatus, into the lateral wall of the nose. Then there is a very important structure is known as conchal crest. Now this conchal crest articulates with the inferior nasal concha, which is a separate bone. So where is the conchal crest? So when you will see the conchal crest is this. Now this is the conchal crest, and this conchal crest is going to articulate with the inferior nasal concha. This inferior nasal concha will give it projection is known as inferior nasal concha, and below that you will have a space is known as inferior meatus. Clear? So here you can see this is isolated maxilla. Now here we have the placement of inferior nasal concha. So this is the inferior nasal concha, and below the concha you will have a space, and this space is known as inferior meatus, and this is a line of articulation which is known as conchal crest. Clear? Now on the nasal surface, what are the important things which you should know? The opening of maxillary sinus is not this large one. The sinus opening is very small, and to make it small, there is a contribution of 4 bones. Now these 4 bones are going to convert this large opening into a small opening. And this is a question of your exam, which are the bones converting the hiatus opening into a small opening. So one is known as uncinate process of ethmoid, which comes from above. So from above you will have a articulation, and that is your ethmoid bone uncinate process. From anterior side you will have a lacrimal bone which will come here, that is the lacrimal bone. Then you will have inferior nasal concha which will come here, just I told you, and you will have perpendicular plate of palatine bone from posterior side. So one bone from above, one is anteriorly, one is from inferiorly, one is from posteriorly. So what are the name of these bones? This is the ethmoid bone, lacrimal bone, inferior nasal concha, and perpendicular plate of palatine bone. All these 4 bones convert this much of large opening into a small area. So here you can see the articulation. I tried to make it clear that how the articulation will take place. So what we have done is that we have removed one side of the maxilla. Now after removing the left side of maxilla, we are seeing the right side of maxilla from the medial side, or you can say the lateral wall of the right maxilla, medial wall of the right maxilla. Now in this medial wall of right maxilla, you can see that this is your, what is bone? Maxilla. Now this maxilla is making a joint here with this inferior nasal concha. Now above that, this is your ethmoid bone, which is a midline unpaired bone, and behind that this is the lacrimal bone. So lacrimal bone is contributing from the anterior side. This is the inferior nasal concha from the lower side. That is the perpendicular plate from posterior side, and this is the ethmoid from above. So these are the 4 bones. So if you will remove the ethmoid, the things are more clear. Now you can see that this is your lacrimal bone. Clear? After removing the ethmoid, you are able to see this is the lacrimal bone. This is your inferior nasal concha. This is your perpendicular plate, and this is your ethmoid bone. So in such a way, these 4 bones are present all around the opening, and it is converting the hiatus into a small area. Now we'll have one more important thing on the nasal surface. That posterior part is having a vertical groove, is known as greater palatine groove. Now here in this area, you will find a groove which is known as greater palatine groove for the greater palatine nerve and vessels. Now this groove is converted into the canal. Now how to convert into the canal? It is going to articulate with the perpendicular plate of palatine bone. So here you have to understand that this is the medial surface, this is your palatine bone perpendicular plate, this is the horizontal plate, this is the perpendicular plate. So deep to the palatine bone, you can see this is the canal, and this canal is only present when the 2 bones are there. If you will remove one bone, then it is known as groove. Now these 2 join together to form the canal, and this canal is giving a opening is known as greater palatine foramen. To passage of this nerve is known as greater palatine nerve. Along with that, you will have the artery. So this is the important thing to understand, that this perpendicular plate, and this is the horizontal plate, this is the pyramidal process. So this perpendicular plate articulate with the maxilla, and once it is going to articulate with the maxilla, the groove convert into the canal, and that canal will give passage to the greater palatine nerve. Clear? So in such a way, we have finished the all surfaces of your maxilla. So you have to keep in mind that when you are holding the maxilla, you should keep in mind that it is having the anterior surface, it is having the superior orbital surface, medial nasal surface, and it is having the posterior infratemporal surface. So what are the important landmarks, what are the important nerve and vessels related to these areas should be there in your mind. So this is all for today's session. Thank you. Bye-bye.